In today's Health Watch, a Sturgeon Bay man didn't even know his heart health was in jeopardy.
Local 5's Caitlin Corbett tells us about the innovative procedure to fix it at Aurora BayCare Medical Center.
When David Leno found out he had a blockage in his heart, he was worried about an intense surgery that could take him away from doing the things he loves. But thanks to the team at Aurora BayCare, he found the procedure that was right for him.
Heart murmur? How can I have a heart murmur? Didn't think too much about it, but before they could do the surgery, they wanted to check with a cardiologist.
Back in 2020, David Leno's heart murmur was discovered by chance before a routine procedure. But that wasn't all doctors found.
So what happens with aortic valve stenosis, in simple terms, the valve itself is getting narrowed over time from calcium and cholesterol deposits.
Aortic valve stenosis, in its early stages, a condition that causes the heart to work harder to pump your blood. The Sister Bay native, an active skier who also runs a marina, said doctors estimated it would be another decade or more until it caused him any problems. But just 2 years later, Leno noticed himself feeling exhausted. He didn't think much of it. His stenosis had progressed to severe, and he was referred to Dr. Selke.
So what does this really mean? So of course you go home, you research it, and you go online and figure it all out. And some of the stuff I was reading online, that led me to believe this could be serious.
Leno was right and feared he could be headed for open heart surgery and a long road to recovery. But Dr. Selke, along with a whole team of Aurora BayCare cardiologists, decided on another option, the transcatheter aortic valve replacement, or TAVR.
Really what we're doing is we're accessing the artery in the leg. Once we access that artery in the leg, we put a wire in. Once you have the wire in place, the wire is essentially acting as the rail for the new valve to be delivered. You advance that over the wire. Once it's over the wire in the correct position, you do a balloon inflation. The balloon inflation pushes the old valve out of the way and expands the crimped valve.
After 2 stent procedures to clear out his arteries, Leno underwent the TAVR procedure. It may sound complicated, but really it's a less invasive way to replace the aortic valve, with most people going home the next day.
If you look at transcatheter valves versus open surgical valves, just in the simplest sense, the biggest difference is the downtime. We're not making incisions to the chest, and so these patients are staying really just overnight in the hospital. Whereas with a traditional open heart surgery, they're going to be in the hospital for about 5 to 7 days.
And for Leno, he felt relief he didn't know he needed.
And I could tell a difference immediately. I felt different breathing, my heart felt different, and I had a calmness to me that I hadn't had for a long time. And that was just on waking up. So there was an immediate difference that I could feel.
Leno is now back to doing the things he loves and just finished a ski trip. While years ago he didn't know what was causing his symptoms, Leno says if something is slowing you down, get it checked out.
I think in retrospect, when I started not wanting to do some of the things that I love to do, like the golfing and the skiing, I kind of put it off, maybe not this year. I mean, that was a symptom of what was starting to happen with my body. And so just kind of listening, why am I that tired? Why do I want to go to bed at 5 o'clock in the afternoon? Listen to your body.
Take a heart health quiz to estimate your risk, determine your controllable and uncontrollable risk factors, and receive guidance on what to do next on Aurora BayCare's website. And that's our Health Watch. For Local 5 News, I'm Caitlin Corbett.